Would you define shared decision making, Dr. Lee, and tell us why it's so important for patients to engage in their care?
Yeah, I mean, shared decision making is sort of the ideal model, right? So it's this idea that like we want to kind of, as physicians, we want to know what I want to know what values my patient has, and I want to be able to impart information that I think will be helpful for them to make a decision. So sometimes the decisions are, do I want to do surgery or not, right? Sometimes the decisions are like, do I want to do chemo or continue chemotherapy? Those are very different decisions. And shared decision making is a way of kind of saying, like, we're going to have some kind of like communication back and forth where I'm like, hey, this is what I think is happening. These are the choices that you have. And you telling me, okay, these are the things that I'm worried about. These are the things that align with what I want to do. I think it's really important, though, to not have physicians sort of put it out as like, oh, well, I just let the patient decide, right? Because just like when my car breaks down or my lights don't work in my house and I get an electrician to come and see, like, I have no idea what they're talking about. I have no concept. I really rely on them to say, well, I don't know what kind of like wire for you to use in my house. Like, I have no idea. So we really want to be careful that like that shared doesn't decision making doesn't turn into sort of like a menu of choices that we are actually like the physicians are like kind of giving up their role in advising, if that makes sense. So I think a lot of shared decision making is kind of in that relationship of like trust and kind of saying like, yeah, I kind of really get this. I get what you're telling me. So I have patients, for example, who are on, chemotherapy for recurrent disease and either uterine or ovarian cancer. And a lot of times we're sort of making these decisions of, okay, quality of life, like what are events that are coming up? So sometimes they don't always align with what I think is best, right? But if somebody tells me like, you know what, I'm going to do these 3 cycles, but my son's wedding is coming up and I need a month off beforehand, like I mean, that aligns for me because I think that's important, but maybe it's not the standard, right? Like maybe and so kind of really knowing your patient from my perspective, and then also as patients not being afraid to say these are my values and this is what's really important to me. I think people will hear it and they'll feel better equipped to be able to help you guide those decisions, right? With the caveat that sometimes I'll say, look, you know what? I'm pretty worried about you. Like, yes, let's give you a month off before, but let's scan right after the wedding and see what's going on. And then we can decide what we're going to do after that, right? Or holiday times are often times where I really give people sometimes a break, right? If they've been on chronic chemotherapy, sometimes this is a time where I'm saying, you know what, I'm really worried. I don't think we can give you a break, right? Or I'll say, and people will tell me, I know you're worried about me, but this is really important. And we work together on it. So I think it's knowing kind of the medical background and then like making sure you know what your patient wants, I guess, from that perspective.
And having an open line of communication. I think
Yes,
that's what you're saying.
exactly. I think you hit it on the nail. That's right. Like having an open line of communication and not feeling that you need to hold back from that. I think it's much easier for our whole team, like our nursing team, so I work really closely with our nurses and our PAs. And sometimes one of the nurses will be like, you know what, she really wants to talk about this, right? So sometimes it'll be maybe not even talking to your doctor first, right? But talking to the person on your team that you feel closest to say, you know what, I've been really thinking about this. I know Dr. Lee wants to do this, but this is, doesn't align with my kid's graduation or my grandkids something. And those things are really important to get that open.